So we are Women's Health Associates. We are an all women owned clinic. So we service to obstetrics and gynecology. We have two providers. We have an LVN and an RN who are also a part of PerfectServe. They are the ones that will take on call if Summer or Dr. Bell Henry are out of town, anything like that. I'm the office manager here. I started off as the medical assistant 2 years ago, and I'm going on my third year here. But I just recently graduated from Texas Tech and I got a bachelor's in healthcare management.
What are the needs like in your specific area of the country?
Most definitely obstetric care. We have lots of OB patients right now. We typically see about 50 OBs in a week. We have a lot of gen patients who are having irregular bleeding problems, those who are needing surgery, such as hysterectomies or some type of biopsy to see as to why they are having these irregular bleeding episodes or the pelvic pain, contraception management. We do it all here.
And so, what are your hours too?
So our hours here are Monday through Thursday, 8 to 5. We are closed from lunch from 12 to 1. So we do get on call calls during lunchtime too. But of course, most of them are just like, I've been needing a prescription refill. We're like, you can wait a good 30 minutes until we return back to lunch to get that taken care of. But unless it's significantly an emergency, then we'll definitely handle that while we're at lunch. I feel like right now there's a lot of providers in the area that are not accepting any new patients due to them being completely full. And thankfully, right now, we're accepting patients. These patients come in again with bleeding issues, or they feel like other doctors in the past have never actually listened to their needs. So we always want to make sure that we're giving the patient the right care. Typically, with Summer and Dr. Bell Henry, a patient, she's been having bleeding issues for 5 years. We're able to fix that in 3 months. It's just life changing for the patients. So I'm pretty much in the front, in the back. I do it all. And we are private practice. So for a lot of our OBs, Dr. Bell Henry, she has access to both hospitals here for deliveries.
So she sees a patient in clinic, that
Mhm.
patient's like, "Baby's coming." They go to the hospital, and then she has to go to the hospital in that moment.
Yeah, this week she's had to leave clinic twice because she's had patients going into labor and she's like, I gotta go. So Summer will go ahead and see some of her patients until she returns back.
Before Perfect Serve, what was that like using them? Did you have a lot of misrouted messages?
Yeah, a lot of misrouted messages. It was very difficult for us when we were closed for holidays or we were having to be closed for a snow day. Our calls weren't being transferred and it was just really a hot mess. And with them, the pricing was increasing significantly. And it was just something that was kind of out of our budget. And once we were approached by Perfect Serve, we thought that this was going to be the perfect move to make. Actually, Summer, she'll be gone in July for a whole week. So one of our nurses will be taking on that on-call service.
So when those things happen, you have to mitigate or I guess fill in the gaps with the scheduling and you manage the scheduling.
Yeah, exactly. And that was one thing that Nicole, it was so difficult because Summer was out for about a month and a half due to her mom having breast cancer. So she was with her in her treatments and she was the on call. And so she was receiving calls all the time on top of her mom's health. It was hard for her to manage both. So we went ahead and switched over to one of the nurses, but somehow Nicole wasn't actually transitioning that to one of the nurses. So that was one of the most things that was frustrating with them is that they would say that they switched it and it never was done. Once we switched to y'all, it was very easy access for us. One specifically because it's an app that we can use and we're able to add on our nurses in case one of the providers is out for vacation. Summer has been using that part of the app where it has our phone already located on there. She enjoys using the app. It's a lot more convenient than what we were used to. One, because she has access to the app, so she's able to view everything through there. And also being able to message one another, such as myself, the nurses, if anything. And I think it's a lot easier for her to receive these calls or messages through Perfect Serve.
Do you tend to collaborate frequently? Like maybe the nurse is dealing with a patient and that nurse has to then message the doctor.
There Has been a couple times where Summer has received a message and she is unable to take it. One, either being in a meeting, so she'll forward us that message for us to see. So then we will go ahead and get on that and make sure that the patient has been reached.
And do you feel like that saved you all time?
Yes, because we don't want to miss any calls from our patients and we don't want our patients to feel like we're neglecting them. So if Summer's unable to get in contact with them, then she'll forward it to us and then we're the ones able to call the patient, get them sent, or see what's going on with them.
As far as patients calling in about their prescriptions, is that another piece of that too?
Yes, for instance, I had one patient last Friday. Summer had already left because she had to go for a meeting, and that patient, she was an OB patient, and she was only about 7 weeks, 8 weeks, and we were needing to start her on progesterone, and she was having a hard time getting that filled because there's a back order on that specific medication. So she was able to get through to us through the on-call service, and so thankfully I was still here at the clinic past after hours, so I was able to get on that and help the patient find a pharmacy that had that prescription.
So do you manually do it on your end? Like, you just swap it real quick right there and just make sure it happens?
Yes, and that's what we liked about it too, is, like, being able to have that access and creating our own schedule on who's on call.
When you worked with our implementation team to set up the prompts and the patient education piece of that, how'd that work for you?
It was great. I cannot remember her name, but she was very helpful in being able to create the lines and the scheduling and being able to send me information about how to use the app and how to get set up. And there was actually a day where I didn't get set up on our start date, which I think was January 7th, but we were just so busy in our clinic that I completely forgot. And she reached out and she's like, "Hey, I noticed that y'all didn't have y'all's on call thing started." I'm like, "Oh my god, thank you so much for reminding me." So then I got on that day because, of course, we don't wanna have our patients calling and they don't have anybody to speak to.